Well done.
Sure.
Okay, right. Welcome, everybody. Welcome to Tuesday again. And the next session, I didn't have any takers on my request for testimonies tonight, which I think is a good thing because the things I'm discussing tonight, you probably don't want to experience or have experienced at any given time. So I'm going to share my screen over here. And we're going into part 2 of the hands and feet, or of the hands and fingers, basically. There we go. Okay, I think I've got a pretty full show tonight, so I'm going to get moving over here. And we are going into part 2 of the hands and fingers. And tonight we're covering, well, we're starting to get into the area that are things that I see fairly regularly at work. As you know, by day, I spend my day fixing people with braces. I am what's known as a medical orthotist. It's a horrible, great big word. And you do not want to meet me because we normally meet by accident and you're in pain and you don't want to see me. And this is something that I see fairly regularly. It's a thing called carpal tunnel syndrome. And it comes about when the fingers develop a burning sensation or tingling. Normally the thumb, the index, and the middle fingers are frequently involved, and I'll show you on pictures shortly. Sadly, a lot of times I see people after they've had surgery for this thing. And this is the areas that you will normally feel the pain and the burning, etc. And it's usually, it's the ulnar nerve that is affected over here, the ulnar being this one and the radius being, the ulnar being the outer one, the radius being the one near the thumb. Sorry, my anatomy is a bit rusty. And a carpal tunnel may make it difficult to grip objects or to make a fist. And this is also similar with peripheral neuropathy, which we'll get into at another time. The symptoms usually begin at night, perhaps due to decreased circulation. And it's basically people complain about they wake up and their hands are stiff and they're burning, or they don't feel comfortable. Carpal tunnel results from inflammation of tendons and ligaments in close proximity to the carpal tunnel, which is in this area over here, which encloses nerve tissue in the wrist. And it's sort of about that little area over there. So you'll see where that band is. There's a whole lot of little bones over here in the wrist that give us the flexibility that we need. And the nerves run through those bones. And what happens is the nerve swells and the little channel, which is made from bone, doesn't get big enough. And you have compression, which leads to all sorts of fun issues. Pregnancy, diabetes, and obesity may aggravate or induce the condition, but there are other things that cause it as well. Vitamin B6, which is a natural diuretic, may be an important preventative. Whoops, I can't see my pictures over here. Yeah, so you can see the words at the top of the page and I can't. So Dr. Falk has found that prolonged use of vitamin B6 was necessary for improvement of carpal tunnel. And this he found during a 6-week double-blind trial that wasn't successful, but he kept it going and did a 12-week trial, and that was successful. So if you take a course of vitamin B6 for about 12 weeks, you should hopefully be able to escape being operated on. Many people fail to understand that the benefits of good nutrition are accomplished through the use of adequate nutrients for a sufficient period of time. So you can't just take B6 for a couple of days and expect miracles to happen, or take a multivitamin for a couple of days and expect miracles to happen. And I do feel that a lot of people look at nutrition in that way, and you take a medication and miracles happen within a couple of hours or a couple of days, but nutrition doesn't work like that. Nutrition needs to be done over a period of time. Dr. Porkos found that B6 did not work alone. So once again, you can't just have one B vitamin or one C or one E, etc. For the B6 to be effective, it needs B2, because that converts the B6 to its biologically active form. So it's no good just popping a tablet if nothing's going to happen to convert it. And this happens a lot with synthetic vitamins. You'll have your isolates, which are a little bit more expensive. And obviously they must be good because it's now the concentrated B12 or the B6 or whatever, but it actually needs to work in conjunction to a few other things. Those with degenerative conditions often have multiple deficiencies due to genetic weaknesses, poor diets, or faulty health habits, or a combination thereof. The lack of one nutrient can alter the ability to utilize other nutrients. According to research by Drs. Hart and Chow, the shortage of a single essential vitamin, mineral element, amino acid, or fatty acid will create a shockwave that spreads to affect utilization and or function of every other essential nutrient. And this is where I find nature so fascinating, because we need to have this whole big network of everything. And if you think about it, it's a little bit like our business. One distributor on their own isn't going to get very far. So we need the combination of a whole lot of other distributors, each with their own unique talents, to come together to make the team work. Have you not seen that in this business? Dr. Roger Williams described the basket of nutrients essential for life and health as nutritional chain of life. Old GNLD distributors will recognize this little picture to the left of my screen, where we're needing the carbohydrates, the lipids and sterols, the protein, the minerals, the vitamins and phytonutrients, enzymes, all working together for cellular nutrition. Dr. Williams also wrote, the chain representation is used to emphasize the fact that all links are needed. If even one link is missing or weak, the whole chain is weak and the favorable environment disappears. In other words, life is very, very delicate. According to Dr. Jim McAfee, he has learned that the results of supplementation are far better if a few extra nutrients are provided than if one key nutrient is overlooked. So vitamin B6 deficiency symptoms include morning stiffness of fingers. So you wake up and your hands are tight, and sometimes your hands are sort of curled up a little bit like that. Impaired sensation in fingers and impaired finger flexions. You can't do this sort of thing. Pain in hands, weakness of hand grip. So you find it difficult to pick up your first morning cup of coffee, and you end up dropping it all over your bed, which is not a good thing. Nocturnal paralysis of arm and hand, big fancy terms. Nocturnal obviously just means night, and paralysis means your hands and your arms go to sleep, and you wake up with this numbness. It's like sitting with your legs crossed, and you try and stand up and your foot has fallen asleep and you fall and land on your head. The other symptoms include rheumatism and arthritis. We covered that last week, the difference between rheumatic arthritis and osteoarthritis. Painful and stiff shoulders, elbows, and or knees, so your main joints. And fluid retention in the hands, feet, and or ankles. And again, I see people with these symptoms very, very regularly. And I have to bite my tongue because legally I'm not allowed to say anything because it is out of my expertise that I am qualified for. These symptoms may be an everyday part of your life that could be eliminated by the addition of a few essential nutrients to your diet. So people go through all this pain and suffering when actually, they're not missing a drug, they're missing some basic nutrients. So the suggestions, I'm moving my pictures around just so that I can see what's happening. So the suggestions include avoid drinking excess coffee. And coffee is, while it's very nice, too much is bad for you. And that's when your coffee has to look at you like that instead of the opposite way around. And we need to avoid substances to which you are allergic. Again, sounds logical, but as we spoke about last week, there's a lot of things that we could be allergic to that we don't even realize. We need to allow at least 3 months for supplementation to work. So it's always good when you're putting somebody on a supplementation program, tell them they need to take these products for a minimum of 90 days before you can expect to see any big results. We need to supplement with vitamin B complex that obtains at least 50 milligrams of B6 for at least 12 weeks. And our vitamin B has got everything, or all the vitamin Bs that we need in a sustained release form, so it stays in your body for up to about 6 to 8 hours. And we need to supplement with omega-3, being anti-inflammatory, calcium, and magnesium. And there's our salmon oil, and we know our CalMag. This is a thing that I see fairly regularly. Excuse me for a minute. It's got a big fancy term called Dupuytren's contracture. And again, I'll often see these patients after they've had surgery. Surgery, while very effective, does not work on everybody because, first of all, if your surgeon is not that careful, there can be issues. And some people tend to scar more easily than others. And often the scarring ends up being more of a problem than the original problem. And Dupuytren's contracture is when the skin shrinks or hardens in the center of the hand, forming a nodule or lump near the small or ring fingers in this sort of area over here. This picture over here is quite a bad case. There are slightly less bad cases that I see fairly regularly. This contracture is a risk factor for diabetes. So if you know somebody with this sort of problem, let them be tested or checked for diabetes. Over time, the fingers will be pulled towards the palm, and it can end up like that. And in severe cases, this can interfere with normal daily activities because they literally cannot open their hand. Diabetes researchers at New York Medical College found more than 90% incidence of glucose intolerance in patients with Dupuytren's contracture. That I found quite interesting, and I will be advising my patients to speak to a dietitian whenever I see them from now onwards. Refined sugar, excess fats, and excess carbs should be avoided. Where do we find these things? Junk food. Dupuytren's has been improved by supplementation with vitamin E and zinc and antioxidants that are known to protect against diabetes. Dupuytren's is more common in those with seizure disorders, alcohol-induced liver disease, and smokers. And so your seizure disorders would be people like those suffering from epilepsy. Suggestions: simple, logical, but not always easy. Avoid sugar and refined carbohydrates. Be aware of increased diabetic risk, and if in doubt, please consult your GP and/or dietitian. Supplement with antioxidants, including vitamin E and zinc. And as we know, with our vitamin E, it contains a chain of all 8 of the E's, not just the single alpha tocopherol that is found in most commercial vitamin E's. Ours has got the alpha, beta, gamma, and delta tocopherol and tocotrienols. And then the zinc, obviously in the chelated form, makes a very, very big difference. Flattened or spoon-shaped nails. We're going to cover quite a few nail issues tonight. So ladies, don't always be in too much of a hurry to have your nails painted and covered, because they could be telling you things, and if you hide them under fancy gel coating, your body's yelling at you, but you've got your noise reducing headset on, you can't hear it talking to you. This sign often reflects iron deficiency or excess. So again, we need an optimum amount, not too much, not too little. Nails can also flatten for other reasons, and these include Raynaud's disease and other anemias such as those caused by vitamin B12 deficiency. Spooning of the nail is common in iron deficiency, although it can sometimes appear in a disease called hemochromatosis, which is a genetic disease that causes your body to create excess iron. Iron deficiency is believed to be the most common deficiency worldwide and the most frequent cause of anemia. And anemia is a very common problem these days. It is found regularly among children who don't eat meat or other iron-containing foods, and you'll also find that in vegetarians. Menstruating women lose iron monthly with blood loss, so it's essential that we keep our iron levels up. Older people become low in hydrochloric acid, which can make it difficult to absorb iron and convert your vitamin Bs. These are some of the foods that you'll find iron in. Quite a wide variety, but iron, like most minerals, is not easily absorbed from the diet. Iron is abundant in plant foods and is not that easy to absorb from vegetable sources. And sorry, my writing's been covered again. Therefore, vegetarians or vegans are at considerable risk for iron deficiency. Other symptoms of iron deficiency include tongue inflammation, inflammation of the corners of the mouth, a pale complexion, and fatigue. So anybody suffering from chronic fatigue, can check their iron levels. And you can often see people with pale complexions, not just computer geeks. Iron deficiency can cause a craving for ice. And if you're eating a lot of beets or beetroots, you will have pink urine. I've thought those were quite interesting signs as well. Many iron deficiency symptoms result from poor ability to deliver oxygen to the tissues and the inability to produce energy. And once again, I will liken our bodies to an engine. If you do not get enough oxygen where the spark is firing, your fuel will not ignite and your car will not go. Same with us. We don't get enough oxygen, there's no energy, and we don't go anywhere. Extreme fatigue and mental retardation are common with extreme iron deficiency, and we are talking extremes, not just little. The elderly may develop restless leg syndrome with iron deficiency. Supplementation with a poor quality, sorry, let me rephrase that. Supplementation with a poor quality iron supplement can cause nausea, flatulence, diarrhea, and black stool. And I know if my wife has iron supplements from the blood lab or blood bank, she often ends up with some of these conditions. However, when she takes our Neolife iron, she doesn't have any issues. Iron is toxic in excess, and especially those with hemochromatosis. So if you suspect you have this condition, please do not take any excess iron without the strict guidance of your doctor. Children can be poisoned if they ingest excess iron, so be careful. Excess iron acts as a free radical and tends to encourage bacterial growth. So sometimes it may look as though we are low in iron, but actually we've got a bacterial overgrowth that is hiding the iron. So we don't always see it. One should only supplement with large doses of iron under the care of an experienced physician, so somebody who actually knows what they're talking about. Chelated iron supplements cause fewer digestive issues, and the amino acid bonding decreases free radical activity and improves absorption, which is why Dr. Arthur First developed chelation in the first place for all of our minerals. Suggestions: be wary of excess iron intake. Support stomach acid if it is low and contributing to anemia. I would suggest doing this in combination or in consultation with your physician, and supplement with chelated iron if you are deficient. While our chelated iron is currently off the market, we can also utilize multi-mineral with alfalfa. I can't wait for our iron to get back because I think a lot of people need it, but you'll also find iron in Formula 4 as well as the multi-mineral. And when you're having iron, please have it with vitamin C, as that improves your iron absorption. So have a look at your fingers. What do your little moons look like? Do you have a full moon, half moon, or no moon? Because if you've got no moon, you've got a problem. The presence or absence of the moons at the nail base may reflect a thyroid function problem. Moonless nails, when accompanied by a broad, spongy hand with sausage-shaped fingers and a tapered little finger, may reflect a lower thyroid function. In contrast, long, narrow, shiny nails with large moons may indicate active thyroid. Thyroid activity varies from person to person. So again, if in doubt, please consult your physician. Thyroid can be suppressed by excessive exposure to fluoride or by a deficiency of thyroid essential nutrients such as zinc, copper, selenium, iron, tyrosine, and essential fatty acids. Suggestions: avoid sugar and caffeine containing deficiency foods and beverages. And these are the good foods and the bad foods for your thyroid. The good foods include your wild caught fish, lean meat, nuts, etc. Bad foods, anything with artificial soy, fluoridated water, too much caffeine, and junk foods. We need to minimize the fluoride use. We spoke about fluoride a couple of weeks ago. We need to obtain nutrients essential for healthy thyroid function. And that we'll get from the multi-mineral. More fingernail problems. Pitted fingernails, these are pinhead-sized depressions in the nails. This sign is characteristic of psoriasis and the most common causes of fingernail deformity. Pinhead-sized depressions may be irregular or form a grid-like pattern. In psoriasis, the nail plate can also separate from the underlying nail bed. The nails often thicken and take on a red or yellow-brown discoloration. I quite often see this on toenails. Those allergic to gluten who suffer from psoriasis may improve dramatically when removing gluten from the diet. Carotenoid-rich and antioxidant foods reduce the severity of psoriasis. Fish oils, for their anti-inflammatory properties, decrease the severity of psoriasis lesions because psoriasis is an inflammatory disease. Those with psoriasis may suffer from deficiencies of selenium, vitamin D, glucosamine, and folic acid. Some of these little things over here are fungus, the top one being your athlete's foot. And there's a lot of other funguses that we are exposed to on a regular basis. Infection may play a role in psoriasis. Those with psoriasis are more prone to nail fungus and improve with antifungal therapy. Dr. Robert Giller observed that those with psoriasis do not tolerate yeast. Those allergic to molds or fungi face a daunting challenge because we are surrounded by these things all over the place. A wide range of foods frequently contain fungi, and these include things like aged cheese, mushrooms, which are fungi, overripe fruits and veggies, tomato products, most alcoholic beverages, processed meats, this is things like salami, bacon, etc., aged meat, so you often find your steaks that have been lazy aged, soy sauce, black tea, commercial juices, yeast and malt containing products, and chocolate. Be careful of chocolate. Most physicians are not taught a great deal about mold problems. Molds are quite opportunistic and can grow in any tissue which is damaged or compromised nutritionally. And there are some people who are prescribed almost chronic doses of antibiotics. They'll be on antibiotics for a year or 2 years, and they will often end up with fungus infections throughout their bodies, which are incredibly difficult to overcome. Molds can cause, oops, better move myself. Molds can cause dandruff, athlete's foot, toenail fungus, and vaginal yeast infections. And I often see people with toenail fungus coming through my office. Antibiotics kill bacteria, but may open the door for fungus infections. Suggestions: consider the possibility of fungus problems and find somebody who knows how to deal with them to get to the cause. Identify and remove allergens from the diet. I would suggest working very closely with a dietitian in this case. Obtain a generous intake of antioxidants from foods and supplements. And these are some of the antioxidant-rich foods. This includes dark chocolate. The other chocolate I was referring to is your milk chocolate. And supplement with fish oils, acidophilus, and garlic. And the reason for the acidophilus is to get your gut bacteria back on an even keel. And garlic, being a natural antibacterial, will overcome all the molds and funguses, etc. A quick early warning sign, QEW test. And it was a very, very, very long thing that I had to summarize over here. But basically, this is a sort of test that you need to do. If you can hold your finger like or hand like that, the lack of vitamin B6 resulted in swelling of the hand and an inability to completely flex the digits, making possible a simple test for adequate vitamin B6, the QEW or Ellis test. So if you can do this, you've probably got enough vitamin B6. If you can't, speak to somebody. And this is the inability to flatten the fingers against the palm with the wrist unbent. So wrist straight and flatten the fingers. This sign provides an early indication of vitamin B6 deficiency. And have you ever experienced tingling of the arms and hands? Do you eat a high-fat and highly refined diet? If you answer yes to either of those questions, you probably have a B6 deficiency. High-fat diets and coffee could deplete vitamin B6 in patients. These are some of your sources of vitamin B6, and I really don't have time to go into this right now. Vitamin B6 is also known as peroxidin, and the deficiency plays a role in hyperactivity, premenstrual tension and swelling, kidney stones, autism, depression, heart disease, lupus, diabetes, cancer, carpal tunnel syndrome, arthritis, tooth decay, asthma, and Chinese restaurant syndrome, which we won't get into just yet. B6 deficiency may also be indicated by trigger finger. So when your finger goes into a spasm like that, and it's very difficult to straighten it out again. A common B6 antagonist is hydrazine. And this molecule binds to B6 receptor sites 100 times more strongly than the vitamin itself. And hydrazine is found in rocket and jet fuel, tobacco smoke, and the growth inhibitor that they use commercially on potatoes and onions. Some people consume more malic hydrazide from potato chips daily than they consume vitamin B6 from these foods shown over here. Other B6 antagonists include a ripening agent sprayed on fruits and veggies, yellow dye number 5, birth control tablets, PCBs, overheated oils, and caramel color. According to Dr. Arthur First, his comment to Jim McAfee was, he does not know how people survive without regular vitamin B supplementation, since these nutrients are necessary, I would go as far as to say vital, to detoxify pesticides. Inadequate intake of B6 contributes to a wide spectrum of health problems. Suggestions are avoid as many B6 antagonists as possible. Supplement with vitamin B complex vitamins, because you don't know how much of the individual you need. Your body does. So you take a complex and your body will use what it needs when it needs it. Test yourself with the QEW test to see if there are indications you might be deficient of B6. White spots or bands on the fingernails. I know I've only got 5 minutes left. White lines, spots, or bands on the nails may indicate deficiencies of protein, zinc, or vitamin B6. 70% of the zinc in the human body is bound to a protein called albumin. Therefore, low albumin levels often result in zinc deficiency. Dr. Carl Pfeiffer observed that white spots on the fingernails could be caused by zinc deficiency alone or in combination with B6 deficiency. An isolated white spot resulting from a short period of fasting or altered diet deficient in zinc or protein. So you'll find like the one fingernail over there, just a one little spot, not all the bands. Frequent small white spots on the fingernails resulting from a prolonged deficiency of zinc or protein is usually accompanied by a compromised immune system. Many women develop white bands on the nails prior to menstruation when estrogen drops zinc levels, often resulting in depression. These are some of the indications over there. Horizontal depression in the fingernail is known as Bowes line, and resulting from a nail infection due to altered metabolic rate during the illness. Lack of a white line at the point of the depression indicates zinc is probably adequate even under the stress of an illness. So if there's just an indentation with no white line, you're probably okay with your zinc. A thing called Mees lines, where a white line crosses the nail horizontally, a virus infection tends to cause a radical loss of zinc from the body. Thus, white spots indicate the timing of an infection. So you can look at your nails and see when you were infected. Consistent white opacity in the entire nail can be caused by a simultaneous deficiency in both zinc and B6. Zinc is essential for a healthy immune system. Dr. James Balch reported that white lines on the nail can indicate other health problems, including heart disease, high fever, arsenic poisoning, or liver disease. Suggestions: keep your immune system strong and build your immune system if illness is causing white lines. Increase protein and zinc in the diet if deficient. These things all sound so simple, but it's not always that easy. And if the sign continues, consider checking other possibilities in conjunction with your physician. And that is the end of my talk tonight. All right, I hope I didn't rush it too much.
That's amazing.
So there's a lot of little things that we need to be looking at. All right, does anybody have any questions quickly?
That was excellent.
Thanks, Sean.
Thanks, Sean.
Next week's one was also going onto things that I see quite regularly in my practice. So this is why I find this section very, very interesting right now, because these are things that I see in people fairly regularly.
That was stunning, Sean. Thank you. Yeah.
Pleasure. Any questions?
Thanks, Sean.
Thanks, Sean.
I'm going to stop the recording.